Hey guys, welcome back to Carpool Karaoke. I'm Dr. Nelson, and on today's episode, we will be doing a session of behavioral therapy with my patient Trinity Warren. Before we get started, I'm going to get her to sign a consent form saying she agrees to all the experiments and for this to be publicized. Thanks. Okay, so to start off, I'm going to ask you a few short questions about the stage of your life. Please try to be as honest as you can, that way I can get the best information to put towards a diagnosis. The first question would be, describe your childhood in 4 to 5 sentences.
My childhood was kind of hectic because my parents had really important jobs and we moved from state to state, and which means I was put in and out of a lot of different schools and a lot of churches, and I didn't have a lot of friends, and I didn't get to see my grandparents or my cousins or my siblings or anything because we were all moving so quick and everything was just so hectic, and it just really put a damper on my emotional stability. And
So the next question would be, describe how you feel like your parents have an impact on your struggles and your feelings today.
Like I said, my parents are very into their job and that's all they do. And like I said, we moved around a lot, which puts a strain on our relationship. And my mom is usually the one that's like a pessimistic person, and she doesn't really like to be involved with anything and doesn't encourage me. But then my dad is really optimistic and likes to look at things with an encouraging light and stuff like that.
So the third question would be, how do you feel like school and or friends play a role in your life?
Well, with school, I was just kind of put in and out of a lot of different schools when I was younger, and which means I couldn't form a bond with any of my teachers, and with that, I couldn't really talk to anybody, so all of the work was kind of stressful because I had to transfer in and out of different classes and different teachers and different learning styles, so I wasn't really as focused as I should be. And with friends, I didn't really have many because, like I said, I was transferring in and out of a whole bunch of different schools, so no friends really stuck.
So another question I like to ask all my patients is, how are you feeling in this current moment?
I feel kind of stressed and I have a lot of anxiety, and I'm really nervous about how this is going to turn out in the end.
So my final question is, how do you cope with your struggles? Like, what are some mechanisms you use?
Well, a lot of the times, like I said, is I just kind of stay in my room and I just feel like I need to be alone. And then other times it's like a switch. It just kind of flips, and sometimes I feel like I need to be with people and I need to talk to someone I trust to be able to cope with the things I'm going through.
Okay, well, thank you for your time, and I appreciate you sitting down with me today. On the next episode, we will continue into your second therapy session, and we will come out with the final diagnosis.
Okay, thank you.
Hi, welcome back to Carpool Therapy. I'm Dr. Nelson, and today I have with me Trinity Warren again, and we're going to be doing our second episode using cognitive therapy. I've also been talking with my partner, Dr. Lohman. She's been telling me some good tips to use, and I might try them out today. So what do you feel like you need help with in your issues?
Well, I don't really know. The past couple months I've been feeling down, and a couple of days out of the week, and then the others I feel like I'm top of the world. So it's just kind of like my emotions just kind of, it's like a switch where I'm like happy and then the next minute I'm sad, and it's just, I don't know what's going on.
Yeah, understandable. All right, if you don't mind, I'm going to try a few techniques that will give me a better look into what you're going through. Does that sound okay?
Sure.
Okay, just to make sure, I'm going to give you the consent form again, and that way everything is approved and you agree to everything, and this can be published. Okay, so the first procedure is ink blots, and I'm going to use it to help me see what you see and give me a little bit more insight about how you perceive things. So what do you see in Exhibit A?
Rain.
What about Exhibit B?
A dark night sky.
What about in C?
I just see the color black.
What do you see in Exhibit D?
A beach ball.
And last one, Exhibit E.
A smiley face.
Okay, Miss Warren, great job. Now we're going to move on to the next experiment.
All right, what's next?
I want you to take 2 hours and draw as many sketches as you can.
Okay.
Okay, 2 hours is up. Can I see your sketches?
Yes.
Okay, after viewing your sketches and hearing what you feel... Okay, after viewing your sketches and finding out what you see in the ink blots, I think the best diagnosis for you would be bipolar depression. Your symptoms of feeling elevated one day and down the next, and your irritability and hyperactivity prove this to be true. Don't freak out, as for there are many therapy options and tons of counseling options as well. Do you have any questions?
Not as of right now, but I will call your office if I do. Thank you for all that you've done. What's the next step?
You're very welcome. I'm gonna have you call my friend Dr. Hackley, and on Monday he will have you come in, and I will let him know that I've referred you, and he will help you get the next step of the help you need.
Okay, thank you.
You're welcome.